Friends for Health is a social engineering movement which envisages to implement a healthcare delivery system which will enrich people's health and life by empowering the people belonging to the bottom of the socio-economic pyramid at the community level to network themselves and collectively improve their own health. Friends for Health aims to empower them so that they can facilitate and enrich their own health through sharing of knowledge, experience and skills on the substratum of empathy, compassion and motivations, all with economic advantages, income generation and sustainability. It aims at helping the urban and rural poor help themselves, resulting in a win-win situation for all.
NGOs that provide free diabetes diagnosis for the poor are few and far. Poor people wait at medical centers like the one shown in this video to receive free medicine and insulin for long hours. Though coping with the disease and the expenses it brings along with it is a problem for these people, they can be considered as the lucky ones who have at least been diagnosed of diabetes.
The two major problems that come in the way of diabetes diagnosis and treatment are the lack of affordability and the lack of awareness.
ಅವರು ನೋಡ್ತಾರೆ ಡಾಕ್ಟ್ರು, ಅವರು ₹300 ಕೊಡ್ತಾರೆ. ಇಲ್ಲ ಅವರು ಡಾಕ್ಟರ್ ಹೋಗಿಲ್ಲ ಅಂದರೆ ಅವರು ಕೊಡೋದಿಲ್ಲ. ಅವರು ನಮ್ಮ ಯಾವತ್ತೂ ಮಾಮೂಲಿ ಇದ್ದರು ಆ ಥರ. ನಾವು ಮಾಮೂಲಿ ಇಲ್ಲ ಅಂದರೆ ಯಾವತ್ತೂ ನಾನು ಹೋಗಲಿಲ್ಲ.
Diabetes is a very good example of the iceberg phenomenon. Only a small portion of the community is diagnosed and a much larger portion of the community which might be suffering from diabetes goes undiagnosed. In India, this is further aggravated by the lack of awareness and the lack of affordability. As such, diabetes has very vague symptoms, and to add to this, the lack of awareness among the people will prevent them from coming to us at a point where we can help them with just diet management and exercise. Usually by the time they come to us, they would have developed complications such as DKA and will need lifelong treatment with oral hypoglycemics or insulin. And once again, they will not be able to afford these medications on a lifelong basis.
Healthcare delivery is traditionally a vertical model with providers and recipients. The providers consist of government hospitals, private NGOs, clinics, pharmacies and laboratories. A recipient is anyone who is in need of medical attention. In the conventional model, the recipients receive healthcare from the providers for a huge fee. While such a model seems to work for the upper rings of the society, it seldom reaches the poor and the needy people who belong to the lower socio-economic sections.
Friends for Health plans to introduce a horizontal model of healthcare. Through this model, we aim to nurture development of community-based groups of friends to enrich healthcare within the community. The entire project will be centered on community health workers who are patients suffering from diabetes or a family member willing to help other members of the community. These CHWs will additionally be provided with formal education, training, certification, supervision and periodic reinforcements to serve the role effectively. These CHWs will be selected and trained by Friends for Health. The CHWs will be financially self-sustained by charging nominal fees for the various services provided. The areas of help provided by these CHWs include awareness, screening, monitoring, counseling, treatment facilitation, and cost reduction.
Friends for Health scores on two basic points of innovation. Firstly, it replaces the traditional vertical healthcare model with a horizontal one. Secondly, it believes in the empowerment of community healthcare workers by making them self-sustainable.
In the first 3 years of the venture, we plan to perform 12 lakh screenings. In the first 5 years, we'd like to spread our venture to other districts of Karnataka state, India and to other chronic diseases. We would be satisfied if we have a net positive impact on the lives of poor and needy people.
Friends for Health, help them help themselves.